Thank you so much, Danielle. And thank you, everybody, for having me tonight. Pros and cons to virtual. It's great that we can all sit in our living rooms and do this. I'm sorry that I can't see all of your faces. But the title of today's talk is Every Woman's Concern. I'm Dr. Nicole Velardo. I'm a gynecologic oncologist at Valley Mount Sinai Comprehensive Cancer Care. And when I think about what most women's concerns are, the two things that come to mind for me in particular that I'm going to talk about are gynecologic cancers and sexual health, because I think these are two things that we want to talk about and should be talking about with our doctors and providers. So the goals for tonight are to create a comfortable environment so that we can talk about women's physical health, mental health, and sexual health. I'm going to kind of talk about various gynecologic cancers, not too much in depth about all of them, but just kind of basic things so that we're aware about our bodies, aware about what to look for and symptoms. And then also for you guys to learn about what resources are available in your community. And at the end, after all three of us talk, we're happy to answer any or all of your questions. So to talk, I don't know if you can see my mouse here, but when we talk about gynecologic cancers, when you look here, this is the pelvis of a female. This down here is the uterus. It's cut open. So there's the inside of the uterus where babies grow, the lining that opens or that grows and sheds with periods. That's called the endometrium. This muscle part here, that's where fibroids are. That's called the myometrium. The cervix is attached to the uterus. It's the bottom part of the uterus here. These are our fallopian tubes and our ovaries. This is the vagina here, and then the vulva is the outside. This area actually is all normally about 5 to 6 centimeters. It's all very small, and all of these things are connected. However, each individual part can cause its own problems and have its own symptoms. So even though they're all connected, ovarian cancer is different than endometrial cancer, which is different than cervical cancer, which is different than vulvar and vaginal cancer. So it's really important that we understand where all these things are, what they look like, how they present, and what to look for. So I'm going to talk first, just again, kind of touching upon basic things that I want to teach you guys about to be aware of. I'm going to talk about endometrial cancer. Endometrial cancer you'll hear is used this similarly as uterine cancer. The endometrium is that lining, the inside of the uterus. Okay, so if you hear endometrial cancer, uterine cancer, they're generally talking about the same thing. Here is the top 10 list of all cancers in the United States in men and female, and you can see uterine cancer makes the list. It's number 9, and it's the only gynecologic cancer that's on that top 10 list. And so it's rising in incidence, and more women are getting it. I'll talk about that in a second, but it represents about 3 to 4% of all new cases in the U.S., cancer cases in the U.S. annually. One of the reasons why it's rising is also because of obesity, but we'll talk about the risk factors for endometrial cancer here. And this is what's really important to know. Women want to know, am I at risk? Will I get this? The age. So uterine cancer, endometrial cancer is more common in older women as we age. And so the age range I write here is about 45 to 74, with it most commonly presenting in the early 60s. The two biggest risk factors are obesity and hormones, meaning unopposed estrogen. This does not, and this is the most important thing that I will say tonight, it is not hormone replacement therapy that will give you endometrial cancer. Hormone replacement therapy can be very safe. It is in excess or unopposed estrogen. Obesity, fat cells in your body actually make estrogen. And so it's when your doctor talks to you about losing weight, etc., it's not, yes, we want to be healthy, but obesity, the fat cells in our body, actually, there are different enzymes that make increased estrogen. Estrogen makes the lining of our uterus grow. And as things grow, cells can kind of get messed up the more that they're overturning and growing. And instead of just being nice and normal, the more that they're growing and overturning, they can become abnormal and cancer. So that's the link between being overweight, obesity, which causes that extra estrogen, which causes the lining of the uterus to grow. And so that is one of the biggest risk factors for endometrial cancer. Metabolic syndrome and diabetes, so the high blood pressure, obesity, high blood sugar, insulin resistance, all of these things also kind of mess up the enzymes and pathways in our body and can lead to uterine cancer. Family history. something called Lynch syndrome. So if you have a strong family history, if your aunt had uterine cancer, your mom had uterine cancer, your sister, you should start talking to your doctor. Hey, is there something going on here? Um, I write nulliparity, and not in the sense that if you don't have kids, nulliparity means not having children. So having kids is actually a protective risk factor against for uterine cancer. That doesn't mean if you've never had kids that you're going to get uterine cancer. The reason for that is because when you're pregnant, you're not ovulating and producing as much estrogen, et cetera. So that is just something when you're talking to your doctor to let them know I've never been pregnant or I have X, Y, or Z kids. And so all of these things that you should be talking about at your appointments can kind of put you into a risk factor bracket of, do I have any of these risk factors or don't I? Tamoxifen is a drug that people maybe commonly hear about that's used to treat breast cancer. It does not mean that if you're on tamoxifen, you're going to get endometrial cancer. And that's the biggest thing I want you to take away from this. If you have anything on this list, it does not mean you're going to get endometrial cancer. These are just things to be aware of in yourself to say, oh, I'm on tamoxifen. What is my risk factor? I should talk to my OBGYN about it or my medical oncologist to say, do I need any extra screening or what should I be looking for? So again, these are things to just say, oh, X, Y, or Z applies to me. Let me talk to my doctor to find out what I can do about that. These are the signs to look for at home, right? Again, if you have any of these things, it does not mean you have endometrial cancer, but my job is to kind of tell you things to look for. So if let's say you're 45 and you've always had regular periods and all of a sudden they start to get heavy or they start to last longer or you're having periods twice a month. Again, that does not mean you have endometrial cancer, but it means you should talk to your doctor about it. Do you need a biopsy? Do you need an ultrasound? You just need to kind of know you're normal so that you can then talk to your doctor about when something has changed. Postmenopausal bleeding. So again, the definition of menopause is not having a period or not bleeding for one whole year. So if you're 65 and haven't had a period in 15 years and all of a sudden you notice some blood when you're going to the bathroom, talk to your doctor. And by postmenopausal bleeding, it does not have to be a big heavy period. It can be pink spotting one time with one wipe when you're going to the bathroom. That is enough to at least talk to your doctor about so that he can do the, or he or she, sorry, mostly she, can do the next workup. Pain or bleeding with intercourse, pelvic pain, changes in bladder function. Again, this does not mean you have endometrial cancer, but if you've always had normal bowel movements every single day and all of a sudden you're constipated every single day for a while, again, doesn't mean you have a cancer, but these are just important to kind of know what your baseline is. So if something is different or changes, you can talk to your doctor. When I talk about ovarian cancer, I just kind of want to briefly say that endometrial cancer, when we look at these signs, because bleeding is one of the most common causes, it's something noticeable to a patient. Most endometrial cancers are caught at very early stages, and most are very curable. That's the opposite for ovarian cancer. Ovarian cancers, the majority of them are caught at very late stages and are not curable. And the reason for that is because the symptoms are not obvious. There's not really bleeding or something that kind of makes us, oh, well, that's different. These are the symptoms of ovarian cancer. I feel all of these every day, right? Like bleeding, a little pelvic pain. Sometimes I'm full, sometimes I'm too hungry, sometimes I pee a lot, etc. So all of these things, we could feel any of these on a daily basis. That's why it's really it's hard to kind of know when something's going on. And two, it's really important to just know what your normal is. If you are constipated at baseline and have a bowel movement just once every 3 to 5 days, and that's your normal since you were 18 years old, that's okay, right? It's if there's a change. If that's your normal, and then all of a sudden you're having bowel movements 3, 4 times a day, etc., doesn't mean you have ovarian cancer, but it means, hey, I should go and talk to my doctor about it. Most symptoms are a difference or a change that are present kind of daily for at least a month. And so, if really it's been a month and you're experiencing just a change in bowel movements, bladder habits, etc., talk to your doctor. Go to your primary care doctor. A lot of my patients start with a gastroenterologist. Anyone, just kind of bring it to somebody's attention because this might indicate that something's going on. Cervical cancer, again, that's the bottom part of the uterus, right? Again, everything's connected, but very different. Cervical cancer is what we can screen for with a pap smear, okay? And that is, a lot of patients sometimes think that, oh, well, the doctor did a speculum exam, they must have did a pap smear. No, it's not true. The pap smear is actually taking a little probe and scraping the cervix and the cells. What it's looking for really is HPV. HPV is the virus that causes the majority of cervical cancers. So HPV does not run in, cervical cancer does not usually run in families. So if you say, oh, my mom had cervical cancer, I'm a little less worried that it's not something that's passed down, because the majority of cervical cancers are caused by HPV, which is a sexually transmitted disease. Does not mean you're having unsafe sex. Everyone has HPV. Over 80% of women have HPV. All men have HPV. They're the ones who give it to us. So I say this, the only way to really prevent cervical cancer is to prevent HPV. And the way that we do that is with the HPV vaccine, which is very safe and FDA approved for ages starting at 9. And it's FDA approved all the way up through 45 to 46. I know it's always really scary if there's any moms out there. I'm a mom of 3, to think about having your young 9-year-old boy or young girls vaccinated against, quote, a sexually transmitted disease. But it does not have to be scary. It actually is very protective for them so that they never get HPV in the first place. That's really what we're aiming for. Please talk to your pediatrician and your primary gynecologist about it. There's a lot of misinformation out there these days about vaccines. This vaccine in particular is very well studied for decades and decades and has no real long-term health consequences, and really is the best thing that we can do for our kids and ourselves to prevent cervical cancer. It's really nice to have actually something that we can do to prevent a cancer, because we don't have that for uterine cancer and we don't have that for ovarian cancer. As I get to in this slide for screening, women say, okay, well, what can I do? I go to my gynecologist. You should go to your gynecologist every single year for a pelvic exam. And you say, okay, well, how can I screen? What can we look for? What can we do? And like I said, for cervical cancer, you're going to get a pap smear. You might not get a pap smear every year. Some patients do, some patients don't. It depends on what their history is. If you've had normal pap smears and never had HPV before, you really can go every 3 to 5 years. There are some guidelines that say if you've never had HPV, your chance of getting cervical cancer is so low and it takes so long to develop that your doctor might tell you it's okay to wait 5 years. Your neighbor across the street might have a history of HPV or a LEEP or abnormal cells, and they might be getting them every year. So, the goal of this presentation is not to tell you what category you're in and how often you should get it. The goal is to just tell you, my pap screening might be a little different than my neighbor, because we're trying to do it based on people's individual history. And so talk to your doctor, ask them, why am I getting it every year, but my neighbor's getting it every 5 years? That, they should be able to tell you what is right for you. In terms of uterine cancer and ovarian cancer, again, if you have no abnormal bleeding, if you don't have any symptoms, if you're just coming for a routine checkup, breast exam, pap smear, you don't need an ultrasound, you don't need a biopsy, you don't need blood work. They have looked at this. I wish there was a magic screening test, blood test that we could do that could say, hey, you don't have cancer right now. And unfortunately, we don't have that yet for uterine cancer or ovarian cancer. They've looked at a blood test called a CA-125. They've looked at pelvic ultrasounds, and we don't have that yet. We have the mammogram for breast cancer. We have the pap smear for cervical cancer. But I hope one day someone finds a screening test for uterine cancer and ovarian cancer, because that will really, really save a lot of women. Family history is really important. And so when I say this, these are just some common familial cancer syndromes that you might hear about out in the community. So BRCA or BRCA1 and 2 are the most common syndromes that are associated with ovarian cancer and breast cancer. Lynch syndrome is a family history of a colon cancer and uterine cancer. And Cowden syndrome is very rare, but you might hear the word. And so that can be associated with endometrial cancer and some thyroid cancers and breast cancers. So just if you hear these words or someone's talking about it in your family, definitely ask and kind of bring it up, or you might hear other people out there. Not everyone needs to get routinely tested. Again, you don't show up to your doctor and say, hey, give me a genetic test, because we need to know, one, do you even qualify? And two, what panel should we even look for? So I say the site of origin of family members' cancer is really important, to kind of really map out, okay, my mom had breast cancer diagnosed at this age. My grandmother had ovarian cancer. My maternal aunt had breast cancer. That would make my ears perk up. If one random distant uncle had lung cancer, that's not making me as concerned that you're at risk of something. So, talk to your family, kind of make a little family tree so that you can see, hey, this is what I have. Bring it to your doctor if you have any questions, and they can tell you if you would qualify for genetic testing if they're concerned or not. Just some common myths that I hear out there in the community, and just for you all to know and kind of educate yourself and advocate for yourselves. One is, I had a hysterectomy. That means I don't need to see a gynecologist anymore. No, that's not true. You had a hysterectomy, but you might still have a cervix, you might still have ovaries, you still have a vagina, the vulva, all these things we have to check for. The other one that I commonly get is, but I get my pap smear every year that checks for everything. And like I said earlier, and hopefully you all have learned now, this pap smear is only checking for cervical cancer down here. It's not checking the vagina. It's not checking the uterus. It's not checking the fallopian tubes and the ovaries. And so you still need to go to your gynecologist and talk about your individual risks, your symptoms, etc. So to go back to the hysterectomy point, if you have a hysterectomy, the most common one is, let's say I have a patient, most of my patients say, oh, well, back when I was in my 40s, I had fibroids, so I had a hysterectomy and the doctor took everything out. Well, what does that mean? Do you still have a cervix, right? Did they take the ovaries? Did they take the fallopian tubes? You still have the vagina, the vulva, yeast infections, vaginal dryness, sexual health, all of these things. And so don't be scared to call and get an operative report, right? Find out, hey, what really happened? What do I have? What don't I have? Because it's really important to know, because we need to know what you're still at risk for. If you have a symptom, what could it be from? Right. So, always ask your doctor after every surgery. These portals and electronic records are so hard these days. Even I can't log in to get my son's stuff sometimes. So I always print everything out and give it to my patients. Here is a printout of the operative report and the pathology report. Right. And so never be scared to ask your doctor for those things and to say, hey, can you show me exactly what I have and what I don't have, and walk me through what exactly was done. And so hysterectomy is not a catch-all term, and I think we use it to mean a lot of different things. So really find out exactly what you have and don't have, because it can be really helpful. This question I get a lot: what can I do to personally prevent myself from getting cancer? I wish there was a magic pill, and it's just going to sound really cliche, but it really does matter. So following a healthy and balanced diet, decreasing red meat, decreasing processed and ultra processed foods, the Mediterranean diet, plant-based diets really are healthy. Alcohol is really being linked to a lot of cancers these days. So decreasing smoking, decreasing alcohol, not just because we're telling you to do the same things and be healthy, but because it actually is, those things really are linked to cancer. Exercising regularly. There's a lot of studies out there that show just movement every day, even if you're not losing weight, moving every day is associated with higher survival after a cancer diagnosis. So I tell my patients, don't give up if you're just because you're not losing weight. Keep moving. It's still doing something good for you. Pay attention to your body. Like I said, just kind of knowing what your baseline is and knowing what it changes can sometimes save your life and prevent yourself from getting a cancer, because you're knowing when to go and talk to your doctor. And the more you stay up to date with your primary care doctor and gynecologist, the more they know you, the easier it is to get appointments when something's going on, etc. And it really is helpful. Um, so I'm kind of just jumping around a little bit because I wanted to kind of talk about gynecologic cancers, risk factors, etc. But I also want to address what sexual health is because I think that these are a lot of women's concerns or stuff that we don't talk about. And so it can be sexual health with or without a cancer diagnosis. And so there actually is a definition, the World Health Organization. I'm going to read it out loud because I think it's really important for us all to know what sexual health is. And it is a state of physical, emotional, mental, and social well being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled. So there actually is a definition, and it actually encompasses a lot of things. And so, I could talk for 5 hours about sexual health in itself, but to kind of touch upon just a few of the most common things that I see women talk about that I think would be helpful for the community. So the genitourinary syndrome of menopause, most commonly known as vaginal dryness. Okay, so why does that happen? It's really important to understand the why, so that we can talk about it. You shouldn't just have to live with it, right? So vaginal dryness, that is atrophy, means dryness essentially. Okay, means a thinning out. And so if you look here on this side, this is this is the vagina, this is the cervix and the uterus. This is the vagina before menopause, so when we're younger, have hormones on board, etc. On this side is the vagina after menopause, when we lose estrogen. Estrogen's the good thing. Estrogen's very, very good thing. And so here you can see that when we have estrogen, before we go through menopause, there's healthy blood flow. The vagina, the lining is thick, it's elastic, there's a lot of fluid and secretions. It keeps it moist and healthy. When we lose estrogen, then the lining thins out. There's decreased blood flow. It becomes thinner. It becomes dry. It's not as elastic, so it doesn't stretch as much. So when it stretches, it kind of tears or becomes like dry skin, right? And there's less secretion. So sex is um, uncomfortable. It narrows, it shortens. There's all these things. Can also be associated with urinary symptoms because the urethra is right there. So women who have recurrent urinary tract infections, right, or it burns every time you pee, or sex is uncomfortable, etc. All of these things, most of them happen because of the loss of estrogen after menopause. So don't live with it. Talk to your doctor, please, because there are so many things that we can do, both hormonal and non-hormonal. Vaginal moisturizers are one of them. So there's three different things. There's lubricants that you can use with intercourse. There's moisturizers that I list a few of them here that you use every night. Like you're going to wash your face, and you get similar to washing the vagina. There's a lot of different formulations. These are some more expensive versions that you can go online if you want to take a screenshot of this. Reverie and Hylogyne are two of the most common ones. They're fabulous. There's no hormones in them. There's suppositories or there's gel. You can place them in the vagina every night, every other night until you kind of reach a good steady state, and then use them every 2 nights. You just use it before you go to bed, and it just kind of helps make everything more moist. It can help decrease urinary tract infections, just kind of get rid of some of the itching and irritation, etc. And so I know it sounds silly to say you wash your vagina every night like you wash your face, but it's true. We have to take care of that too. Um, Low dose vaginal estrogen cream. I'm a huge, 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 huge fan. It's very safe. It's even safe in a personal history of breast cancer as well, which is a whole talk for a different day. But vaginal estrogen cream is so wonderful in so many ways because what it's doing is it's taking this, right? Estrogen loss, we're giving the estrogen back to turn it back into this again, okay? That kind of healthy tissue. And the good thing about vaginal estrogen is it stays local in the vagina. It's not going through your whole body, okay? You're not going to get a stroke or a blood clot or breast cancer or all of those terrible things. It's just going to help the area that you apply it to. There are different ways. There's a cream, there's a tablet, there's a ring. And so it's really, and it can be used in a personal history of gynecologic cancer. It can be used in a personal history of breast cancer. It really just is a wonderful thing so that women don't have to be miserable. So please talk to your doctor. Look, everyone is different, but please, 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 at least worth the conversation, and your doctor should be talking to you about it. There's also other treatment options for vaginal atrophy, painful intercourse, etc. So talk to your doctor about all of these. You can put kind of a topical lidocaine or numbing medication on the outside. Pelvic floor rehabilitation is fabulous. I refer a lot of my patients to pelvic floor for either issues with urinating, if you're leaking a lot, incontinence, kind of any issues that you have with sexual intercourse after radiation treatment, etc. Here are some dilators. Vaginal dilators can really help with vaginal stenosis, which is the narrowing of the vagina. Vaginismus, if people are scared or kind of cramped down. If you have trouble with your gynecologic exams, you can buy some of these online. And I just think they're really a fabulous tool. And I think that one of our goals of tonight is to not even go into too much detail about each thing, but just to let you know that these things exist and that you should be able to talk to your doctors about them. So finally, just to kind of end my portion of the talk, there's so much bad stuff out there, or just let's say bad stuff out there that we don't know where to find anything anymore. And so these are just, if you want to take a screenshot of this, the Foundations for Women's Cancer, Mayo Clinic, and SGO, which is the Society for Gynecologic Oncology, usually has really, really actual evidence-based good information out there that's helpful for you guys. And please, always feel free to call your doctor, ask your doctor. They should be able to tell you where to go to find the right information. And I will end it with my my little ribbons, all the different colors for all the different gynecologic cancers. And so I hope that after tonight, really, the goal is to just learn some of the basic symptoms. Don't worry, you just, if you have them doesn't mean you have cancer. Just to listen to your body, know your body, and if something seems off, act by talking to your doctor. So that is all I have for tonight. So I hope that we learned something about gynecologic cancers and sexual health. And I'm going to turn it over to our other wonderful presenters who will kind of be able to talk about our mind and body as well.
Good evening, everyone. So my name is Lee Slagle-Leeds. I'm the dietitian at the Valley Cancer Center. I'm also a board certified specialist in oncology nutrition. Tonight, I'm just going to go over some diet and lifestyle factors for cancer prevention. And I'm actually just going to go over the American Institute of Cancer Research recommendations. So if you Google AICR, you'll probably get their website, and you can look up all these recommendations yourself. So their first recommendation is being a healthy weight. I don't want you to focus too much on the scale. And when considering weight loss, we really want to go slow, maximum of 2 pounds per week. And the reason being, if you lose too much weight too quickly, it is not just that fat mass that you're losing, it is also the muscle mass that you're losing. And when you regain the weight, you typically regain just the fat mass and also some water weight as well. But it's that muscle mass that helps you throughout life with your activities of daily living. So going for a walk, putting your clothes on, showering independently. So when I talk about weight loss, I always want you to focus on what can I do to encourage healthy weight loss? So eating well and being active. So their second recommendation is be active, which is a minimum of 150 minutes per week. You can, of course, do more than that, but that turns into about 30 minutes of walking 5 times a week. It is also recommended to incorporate at least 2 days of strength training if that's feasible for you. You can always work with a personal trainer on an individualized plan for yourself, or perhaps go to physical therapy first and then graduate to a higher level program. They recommend eating a diet rich in whole grains, vegetables, fruits, and beans. So we talk about a plant-based diet a lot. Dietitians have been recommending plant-based diets for eons. And a plant-based diet does not necessarily mean vegan or vegetarian. What it means is you want to make 2/3 of your plate come from plant foods. The other third can come from lean animal proteins such as poultry, fish, some red meat, and also dairy. We want to limit consumption of fast foods and other processed foods that are high in fat, starches, or sugars. Typically, these are like your frozen meals, things that are convenience items that are very calorically dense, but not as nutritionally dense as we want them to be. So we want to limit consumption of red and processed meats. So red meat is actually any animal that walks on 4 legs. I know when I was growing up, there was a commercial that said pork, the other white meat. Pork is considered a red meat. So we want to limit that to 18 ounces or less per week, and that's cooked. So it's actually more than most people think that they can consume. We do want to skip the processed meats because those have been linked to cancer, and that's the meats that have been smoked, cured, salted, fermented, or have any added preservatives. These are typically, your deli meats, your breakfast sausages, any of like the frozen meats in the frozen section. Those are typically the processed meats that you want to avoid for cancer prevention purposes. We want to limit consumption of sugar sweetened drinks because they can contribute to excess weight. Just a note on sugar. I do know a lot of people hear that sugar feeds cancer and that sugar is basically terrible for you and is going to cause a whole host of diseases. But in reality, sugar in moderation can be perfectly safe in a well-balanced diet. Sugar in excess can cause problems. So the recommendation is to limit added sugars to 10% of your total calories or less. So that will look different for everyone in this group. And I would encourage you to work with a dietitian, and I'll give you some resources after to figure out what the best plan is for you. But we do want to limit sugar sweetened drinks, go for unsweetened when possible. Plain water is, of course, best, but I also know that plain water can be very plain. So if you need to splash some fruit in there or add some like those squeeze things that a lot of people like just to flavor the water, that would be better than doing like a lot of sugar sweetened beverages. Here's where I lose a lot of people, but we do want to avoid alcohol for cancer prevention purposes. It has been linked to numerous cancers. And I know a few years ago, people were talking about, well, a glass of wine is good for your heart health. However, there has been studies that don't find any safe level of alcohol consumption for cancer prevention. So it's best not to drink for cancer prevention purposes. I get questions all the time about supplements. Supplements are not recommended for cancer prevention purposes. If you need a supplement, like many people need vitamin D, some women need calcium supplements, that's something that you want to talk to your doctor about. You want to have some blood work done, maybe a DEXA scan to see if those are necessary for you. And then after you get that blood work back, the DEXA scan back, you can go over like, oh yes, you do need a calcium supplement, you do need a vitamin D supplement, some other supplements you may consider getting blood work done for, potassium, magnesium, phosphorus, but those are typically consumed in enough amounts in the diet. This one may not be applicable to everyone, but for mothers, breastfeed if you can. So if you have someone in your life who is a nursing mother, that's wonderful. Breastfeeding is not easy, so that's why they say breastfeed if you can. And then they also say that after a cancer diagnosis, you want to follow their recommendations as able. Now, I see a lot of patients going through treatment where they have side effects such as nausea, vomiting, diarrhea, constipation, taste changes, smell aversions. So it can be difficult to follow some of these recommendations. I also want to backtrack a little bit and go back to the diet rich in whole grains, vegetables, fruits, and beans. I do get a lot of questions in my line about phytoestrogens. So things like soy, flaxseed that have estrogen-like qualities. And the overwhelming evidence on this is that they are perfectly safe consumed in the diet. Phytoestrogen does not act like estrogen in the diet. And actually, those foods can provide a substantial amount of fiber, which fiber is important for gut health and cancer prevention. So if someone tells you, oh, soy, you should avoid soy because of it increasing estrogen in the body, or flax because it's increasing estrogen in the body. I also had someone say chickpeas because of their phytoestrogens. I encourage you to be gentle with them and let them know, like, these phytoestrogens behave differently in the body than estrogen does. So these foods actually provide a lot of nutrition and fiber and healthy benefits and don't pose a risk. So I said I would share resources. So if you're looking for good nutrition information, like Dr. Villardo said, don't go to Dr. Google. But eatright.org is a reputable organization. That's the Academy of Nutrition and Dietetics. There's also oncologynutrition.org and AICR.org. So that's what I talked about mostly tonight. Valley does have outpatient nutrition counseling. You would need a script from your doctor, and it would go through insurance. But you can also check out a lot of local grocery stores are now employing dietitians. I'm not sure how they're set up, if you need a script or if you can just stop in. But I would encourage you, if your local grocery store does have a dietitian, please talk to them and see if maybe you can get an appointment with them and how that works. Okay, I think I'm a little ahead of time, but Yael is up next.
Okay. Hi, everyone. Good evening. My name is Yael Davidowitz. I am the social worker in radiation oncology at the Valley Comprehensive Cancer Care Center. And I'm going to talk about mental health for every woman at every stage. First, let's talk about, in general, the connection between physical and mental health. Physical symptoms can impact emotional well-being and vice versa. So, for example, if you're in pain, it can impact your eating and your sleeping, which then impacts your mood, and vice versa. Your mood can impact your pain level. It goes back and forth. Stress is exhausting. And if you're already tired from disease or treatment, the stress will just add on to that and make it a lot worse. It is important to address both physical and mental health together and find a balance. You know, in a medical setting, the focus is often on the physical, but the truth is that the better you are emotionally, the better you will feel physically, and again, vice versa. It works both ways. Here are some strategies for managing mental health that are really good for anyone. The first one is mindfulness and relaxation. It includes things like breathing exercises, meditation, and progressive muscle relaxation. So a breathing exercise can be something as simple as counting a number breathing in and a number breathing out. Another common one is with your hand, you can breathe in and breathe out, breathe in and breathe out, and go all the way to the end of your hand and come back, with just until you feel like your breath is regulated. Progressive muscle relaxation is when you are sitting and relaxing your muscles from top to bottom of your body and doing it in a very mindful and intentional way. Physical activity. Sometimes people are just run down, especially if they're going through treatment. But in reality, physical activity does help. And it doesn't have to be anything strenuous. You can actually just pick something gentle like walking, yoga or stretching. Sleep hygiene is really, really important. Sleep is restorative. It's when our bodies heal. And it really is important to make good sleep a priority. Nutrition, as we heard from Lee, eating a balanced diet can boost your mood and energy levels. And there are things we can do to feel better by eating certain foods. And the last thing is building a support system. Family, friends, support groups, professional support, and online communities are available. It's important to remember that you have a choice in who you choose to be your support. Not everyone can be a good support. So you can decide which one is going to work best for you. And it's also good to keep in mind to be open-minded about new avenues of support. A lot of people, when I mention support groups, are hesitant, or when I mention therapy, are like, oh, I don't do that. You never know where you might get the help that you need, and it's important to be open to those avenues. Maintaining a positive mindset. So not in the toxic positivity way where everything has to be good all the time. It is important to notice and acknowledge if you have bad feelings, but then move on from that. Practicing gratitude and celebrating milestones. So gratitude is really about focusing on the things that are going right and the things that are going well, and just honing in on those things and celebrating them. Setting realistic small goals. One of my favorite pieces of advice that I give to patients is to make a to-do list with one item on it. If you do it, you're done with your to-do list and you feel accomplished. So if you, a larger goal may seem overwhelming, but if you break it down to small pieces, you're more likely to get it done and more likely to feel accomplished. Focusing on what's within your control. So we know that we can't control other people, we can't control nature. Trying to think about those things too much will lead to frustration. It's much better to focus on the things that are within our control, like our mindset and the things we can change about our lifestyle. Okay, ways to practice self-care. And again, this is important for patients, caregivers, patients who are caregivers, and really anyone. Keep up with your own medical care and needs and take medications as prescribed. It's important to keep up with your screenings and visit the doctor when you should, and continue taking your medications as you should. Say yes to you. Try to schedule time for yourself, doing something you enjoy. Even if it's a short time, it should be dedicated to you and what makes you happy and brings you joy. Eat nourishing meals. Again, following up on what Lee said, meals can be very healing and soothing, and it's a great way to practice self-care. Get good sleep, as we spoke about. It can help your mood. It can help your physical state. Acknowledge negative feelings so you can move forward. So again, it's important to feel the feelings, and negative feelings are going to come up. It's just important also not to dwell on them so you can move on. Learn to say no. So we all have a limited amount of energy and a limited amount of time. It's important to be able to conserve that for the things that are really important to us, and also to learn when we can say no, even if we feel guilty about it. Express emotions. So this does not necessarily mean talking about your feelings. There are many ways to express your emotions. You can express your emotions through art, music, movement. You can dance it out. You can, write a letter, different ways that you can get those feelings out and express them. And the last two are kind of go together. It's seeking support groups or individual counselor or therapist. They are a way to seek support from experienced individuals, people who have experienced similar things to you, and that could be very helpful. Okay, the psychological impact of a cancer diagnosis. So these are the most common things, the most common ways we see that patients are impacted by their diagnosis. So anxiety is right up there, mainly because of the fear of the unknown. There's worries about diagnosis, future, and treatment. It's extremely common. Depression, which consists of low mood, feeling blue, a loss of interest in doing things that you usually find pleasure in, hopelessness or sadness. Again, it's okay to feel them for a bit because it's natural to feel that way. When you're going through this, it becomes a problem if it becomes persistent. Fatigue is a very common impact and side effect, both physical and emotional. They can both be equally exhausting. And on top of that, you know, once you get diagnosed and kind of enter this world, there's the stress of managing appointments, treatment schedules, and managing the things that your regular life has in it. And that can add to the exhaustion. So, and the last thing is body image and physical changes and their emotional impact. And by physical changes, we mean, you know, hair loss, weight gain or loss, changes in sexual function, all those things can happen. And it's important to acknowledge them and talk to people about it and seek out the help that can help you overcome those challenges. Okay, when is it time to seek professional help? It's important to recognize the signs of mental health distress, meaning when it's already at a level when you should be seeking professional help. Persistent sadness, like we said, poor appetite, poor sleep, and not finding pleasure in anything. These could be signs of depression. It's really important to reach out for help when you're feeling overwhelmed. Sometimes just reaching out to anyone is enough, that they can help you find the right person to deal with what you're feeling. But just reaching out to anyone and letting them know what you're going through. There are many resources available, oncology, social workers, therapists, mental health hotlines, a lot of wonderful organizations that offer groups and other kinds of support. And along those lines, this is a summary of what we do. These are the 3 oncology social workers and what we can provide for the cancer patients while they're going through treatment. And that's pretty much it. Thanks so much.
Fantastic. Wow. So much information. That was incredible. So folks, if anybody has any questions that they want to pop into the Q&A, I'd be happy to read a couple. We have a few moments. But while we wait, I have, oh my goodness, I have a few questions to ask. Lee, I wanted to ask you, sorry to put you on the spot. Can you touch on artificial sweeteners? I often hear in the community that they cause cancer.
So I do get that question a lot, artificial sweeteners and their concern about cancer. So what we've seen from the research is that the research is done in mice a lot of times, and I don't really like animal studies because it doesn't always translate to humans. So typically in these studies that show that artificial sweeteners cause cancer, it's done in mice, and the mice are fed amounts that are not realistic for human consumption. Basically, you would have to drink, like, I think it's like 5 liters of Diet Coke a day in order to get the same amount of artificial sweetener that these mice are being fed. And if you're drinking 5 liters of Diet Coke a day, I have other concerns for you. So I wouldn't be concerned if you're having like a Diet Coke every now and then. But if you're consuming 5 liters, please see a dietitian.
Thank you. Dr. Velardo, who should consider genetic testing, and how can someone start the process of getting those genetic tests done if they don't have symptoms and just want to do things as preventative?
Sure. So the first thing to do is to write down your family history, and say, "Hey, my mom had this, my dad had this, aunts, uncles, brothers, sisters." So write that down. And if you're unsure, you talk to your primary care doctor or your gynecologist. The cancers that run in families that are most associated with ovarian cancers and GYN cancers tend to be a strong family history of breast cancer, ovarian cancer, uterine cancer, and colon cancer. Again, others can be as well. BRCA is also associated with melanoma, pancreatic cancer, etc. So it's more of, you write down your list, talk to your gynecologist is a great place to start, your primary, and then it's our job to kind of say, hey, based on this, I think I should send you to genetic testing. It's our job as physicians to then put in the referral and refer you to genetic testing. What genetic testing means, just to kind of clarify what that is the first thing is a consult. It's like a telehealth visit, and you talk to the genetic counselor, and then they really dive into your history. And then it's a blood test. After you meet with the genetic counselor, they give you a script for the blood test. The reason it's important to get your family history and talk to them first is because there are different panels that test for different things, right? Am I testing you for a family history of colon cancer? Am I testing you for a family history of ovarian cancer? What am I looking for? So you need to make sure that you get the right test. Please talk to your doctor before you order anything online. There's a lot of stuff out there. Anybody can order any kind of saliva kit or whatnot, but it's really important that you know what you're looking for and how to interpret those results.